Okay, so snoring, we all kind of know it, right? Either you do it or maybe your partner does, and well, it keeps you up. It's super common, yeah, but often we just brush it off as, annoying background noise. But what
Hmm.
if it's actually your body trying to flag something important? Today we're going deep into this, looking at the surprising connections between snoring, those pesky allergies, and critically, your heart health. Our mission here is really to pull out the key insights from the research we've looked at, helping you understand why these links matter and what signs maybe you should be watching for. Okay, let's get into it. So, at its most basic level, snoring happens when your airway narrows or gets partially blocked while you sleep. That causes the air trying to get through to vibrate the tissues, making that loud sound. It's not just noise, though. When snoring gets really severe, it's often a big sign of something called obstructive sleep apnea, or OSA.
Right. OSA is where the airway doesn't just narrow, it actually collapses or it gets blocked completely, stopping breathing for short periods, sometimes, over and over all night. And we should probably clarify, we're focused on obstructive apnea today, the mechanical blockage one, not central sleep apnea, which is more about the brain signals.
That distinction's important, and it's fascinating how allergies then weave into this picture, isn't it?
Absolutely. It seems quite direct, actually. If you suffer from allergies, you often get that persistent nasal stuffiness, maybe some swelling inside the nose, and that just makes it physically harder to breathe through your nose, right?
Yeah, definitely.
So what happens? You naturally switch to breathing through your mouth. Mouth breathing tends to make the muscles in your throat relax even more than usual during sleep, which can significantly increase the snoring and the risk of that airway collapsing.
Okay, so the allergies can make the snoring worse, but this isn't just about sleep disruption, is it? The sources we looked at really sound the alarm when it comes to heart health.
Yes, that's where it gets quite serious. The impact on the heart is, well, pretty direct and potentially profound. Think about it. Poor sleep quality,
Mhm.
constantly interrupted breathing, especially with sleep apnea. That puts a tremendous amount of stress on your entire cardiovascular system.
Can you unpack that stress a bit more? What's actually happening in the body?
Sure, during those moments when breathing stops or becomes very shallow, those apneic events, your blood oxygen levels can drop quite significantly. Your body senses this danger, this lack of oxygen, and it triggers a kind of fight or flight response.
Ah, okay. Adrenaline and stuff.
Exactly. Stress hormones are released, your blood vessels constrict, and your blood pressure shoots up quite rapidly. Now imagine that cycle, oxygen dropping, body panicking, blood pressure spiking happening repeatedly, maybe hundreds of times a night.
Wow, yeah, that sounds exhausting for the heart.
It is. It's not just harder work. It's a chronic inflammatory stress that can, over time, lead to significant wear and tear. In connecting the dots, this is why chronic sleep apnea is strongly linked to higher risks of developing high blood pressure, heart disease, arrhythmias, and even stroke. It really underscores why dismissing loud, frequent snoring might not be wise.
Okay, so the stakes are clear, but why does snoring happen in the first place, beyond the allergy link? What are some of the common root causes or triggers the sources point to?
Right, good question. There are several factors. One big one is simply having narrowed airways structurally. This could be due to excess tissue in the throat, maybe a naturally larger tongue, and often this is related to obesity, where fat deposits around the neck area can physically squeeze the airway smaller.
Makes sense. What else?
Then there's relaxed throat muscles. Muscles naturally relax during sleep, that's normal. But things like alcohol, especially close to bedtime or sedatives, can make those muscles too relaxed, increasing the chance of obstruction.
Ah, the nightcap effect.
Precisely. Also, nasal congestion or blockage is key. We talked about allergies, but this could also be from chronic sinus infections or even a physical issue like a deviated septum. Anything forcing that mouth breathing.
Okay.
Your sleep position plays a role too. Sleeping flat on your back often allows the tongue and soft tissues in the throat to fall backward due to gravity, blocking the airway. Side sleeping is often better for snorers.
Simple physics, really.
Sort of, yeah.
Ah,
Age is another factor. As we get older, muscle tone, including in the throat, can decrease, making snoring more likely. And we shouldn't forget smoking. It irritates the airways, causes inflammation and swelling, which narrows the passages and definitely contributes to snoring. Oh, and in kids sometimes, enlarged tonsils or adenoids can be a major physical blockage.
that's quite a list. It really drives home how something seemingly simple can have complex roots. So, putting this all together, what does this mean for you listening right now? When should that snore trigger a visit to the doctor?
Yeah, knowing the warning signs is crucial.
So definitely pay attention if your snoring is very loud, like loud enough to regularly wake your partner or even be heard through a door. Also, if you or your partner notice actual pauses in your breathing while you sleep, or if you seem to be choking or gasping for air, those are red flags for apnea.
And don't ignore daytime symptoms either. Feeling excessively tired during the day despite thinking you slept enough, frequent morning headaches, feeling dizzy sometimes. These can all point to poor sleep quality, possibly due to breathing issues.
Right. And circling back to allergies, if you have that constant nasal congestion that just doesn't clear up with typical remedies, that's another good reason to get checked out.
Absolutely. Getting a proper evaluation can pinpoint the cause, whether it's allergies, apnea, or something else,